Good evening, ladies and gentlemen of the listening audience. This is Sean Shivers, and I'm your host tonight for Health in Harlem. I am back and I'm ready, and we're going to have an excellent show tonight. I got my girl here, Miss Austin. What's up, Vanessa? How you doing?
Hello, family.
And we also have Lori Ray. She is a nurse practitioner in family health at Harlem Hospital, and so is Miss Sawyer. And our topic tonight is going to be something that this community needs. Family health, men's health, health for our community, and that's our show for this evening. So welcome, ladies.
Thank you for having us.
Thank you so much.
No problem. So we're going to just start off the back, and every week in Health in Harlem, we talk about the community situation in this community, the comorbidities, as far as statistics from my understanding from Harlem Hospital's community needs assessment. Central Harlem, East Harlem is one of those areas, the highest as far as HIV, as far as AIDS, asthma, fibroids. I mean, a lot of these different comorbidities, for some reason, it still plagues this community. And this is one reason why this topic is essential. So let's just start off the bat. Vanessa, can you comment on this? Why is this still a plague in our community?
Well, the Family Planning Program has dedicated itself to providing much needed information and education, as well as life-saving treatment in our community. Family Planning Program is one of the comprehensive Title X programs in our community because, as you know, people need to know how to space the birth of their children, how to plan their birth, how to have positive birth outcomes, how to decide when and how many children they want to have. According to Whcr Institute, although access to contraceptive services has improved health outcomes, women and families are still having problems surrounding family planning because 1/3 of pregnancies occur within 18 months of a previous birth.
Get out of here.
And this short spacing between births is correlated to negative birth outcomes such as low birth weights and premature births. In addition to unintended pregnancies, there's 3 million each year. And we know that a half of unintended pregnancies end in abortion. So when I say family planning is a life-saving program, when people think of life-saving, they think of a treatment or a medicine or some procedure that's performed that saves your life. Family planning saves lives because we prevent unintended pregnancies, we prevent life-threatening severe illnesses that are STDs like STDs and HIV and HPV. So these things also can affect your life and your wellness and your health. So when I say we're life-saving, that's what I mean. You have to think of things outside the box.
And then I'm also thinking too, as far as talking about family community needs assessment, like the average education level of a family in Harlem is high school, let's say like 7%. Then they talk about the average income of a family is like $35,000.
Exactly.
52. But I guess that all plays a major part in this as well.
It certainly does. In our community, we have a lot of immigrants in the community. We have a lot of people that we have people that come to family planning clinic every day that just came off the plane.
Get out of here.
That have no insurance. That have no knowledge, they don't even know the language. But luckily at Harlem Hospital, we have a limited English proficiency program where we can talk to the patient in their language. We have Whcr phones and we have translators, and we can provide life-saving medical services in the patient's own language. And we have wonderful providers like Lori Ray here, who's going to tell you a little bit more about the services that we provide in family planning.
So Lori, so what type of services do we offer, or do you offer?
So we offer a full range of sexual and reproductive health services to both men and women, from adolescents through their reproductive lifespan. So we see adolescents up until the age of 59, and so that is providing counseling on contraceptive methods as well as education on prevention of sexually transmitted infections and HIV.
So why is this so easy for females to go in to get their regular routine checkup, and then it comes for a certain female? I mean, like my grandfather. I mean, totally open, whatever. Grandpa, when was the last time you got a physical? Oh, about 10 years ago. 10 years ago. So why is it so easy for to have females come in for their annual physical, but then it's so difficult? We talk about men's health.
Exactly.
Men just coming in, to get your annual.
It's really an educational thing. We need for men to understand. First of all, one of our mottos is family planning is a man's business too.
Yeah.
It's not just up to the woman to decide how many children and when and the spacing of your births. It's up to the family. That's why it's called family planning. And this program services the health needs of men, women, and adolescents. So for us, we get a lot of our male patients from our female patients. So we tell them, all of this wonderful services that you get for yourself, you can avail them to your partner so that everyone stays healthy, because we know because of the STD rates and the HIV rates in our community, it's not just women getting it on their own. They're getting it from a partner.
Got you. Because I was I did a little bit of homework, and I did a little Googling, and it's basically what are some of the top 10 questions that males have difficulty asking their physician. You don't feel right, you're sick, I'm in pain, but yet I don't want to ask my physician certain question. Like, for instance, one of the questions on here is two questions. It says one of the main questions is that when males find, let's say, blood in their urine, or let's just say when men find blood in their semen, they'll go on forever with this condition and won't even ask or get that checked up.
Right.
It's manhood. It's a man thing. I'm just throwing this.
Well, it's cultural too. You have to remember that in our community we have a lot of patriarchal society where men feel that they are the breadwinner, they are the head of the household, everyone depends on them, and they don't want to be, they're proud also, and they don't want anything to show that they have any weaknesses, that there's anything wrong with them. So we really stress education.
Gotcha.
Every family planning visit is based in education. It's not just the treatment and the care. The provider educates the patient, and the nurse educates the patient before they leave, so that they can pass that education fast as we pass diseases. We can pass information and wellness.
Now, is it true? Did you make a comment?
Well,
Yes.
I was just going to say, it takes a certain amount of vulnerability to come in to see a provider and to divulge all these personal, all this personal information to someone you've never met. So really, we need to be able to reframe it to show people that really they're being brave and strong by coming in and letting us know what's going on with them, so we can help them.
You're right. And one thing I want to definitely say to all the men that are listening right now, if you are not feeling well, if you are in pain, you are sick, get yourself checked, because they have something that's called HIPAA. And even though you might think someone throwing a dagger at your manhood or something, what the conversation that you have with your physician is confidential, it's private. At the end of the day, you're there to provide for your family. So, we need another 10, 15, 30, 40 more years onto your life. So if you're walking around in pain, you don't feel well, get yourself checked. It's good. It's all good.
Well,
Self-check.
I'm so glad you brought that up, because the family planning program has a men's clinic.
Got you.
The men's clinic is every Monday from 3 p.m. to 7 p.m. We have services specifically geared for men. They can get a complete physical. They can get their STD testing. They can get their HIV testing. They can get their colorectal. Whatever it is that they need, this wonderful provider that's sitting next to me, she provides service for them every Monday night.
So that's a question that I'm going to ask you right now, Vanessa, because Harlem Hospital Center, the ambulatory care, Ron Brown, they offer all these programs, and it's very difficult because of advertising, because of marketing, is getting it out to the community. Sometimes after shows, I get a phone call, someone tells me, I didn't know they had that at Harlem Hospital.
Exactly.
So is there anything different that your program or your department is doing differently to get the word out to the community about these programs?
Yes, we have a very extensive marketing program. We market in the community to colleges, universities, high schools, family programs, health fairs, daycare centers. We're everywhere, spreading the information. And also, I want people to understand that it doesn't matter your insurance status. If you don't have insurance, we still provide services.
Obamacare.
Well, not only Obamacare, we
Okay.
have something called the family planning benefit.
Got you.
A lot
Okay.
of people that might not even be eligible for Medicaid, we have something called the family planning benefit. And it's also confidential. Like, say you have a teenager who is on their parents' insurance and they don't want their parents to know their business and they want to get reproductive health services. They can get the family planning benefit. And it can be confidential and just for them.
What age is that? What age is that?
They can be from 13 on.
Get out of here.
They can get their own confidential health insurance through the family planning. It's only for family planning services.
Got you.
And also, if you have even a person that's in a domestic violence situation and they don't want their partner to know that they're getting services from family planning, they can also get the family planning benefit. And here's the thing. If you have an undocumented person who comes to this country and they're having a
And
baby.
that was the next question about undocumented immigrants.
Yes. If you have an undocumented immigrant who's having a baby, the minute that she comes to Harlem Hospital Center and gets the services, she's eligible for the pregnant woman's Medicaid, which is, well, it used to be called PCAP. It's not PCAP anymore,
Okay.
but it's for pregnant women.
Got you.
And that benefit, so she can get all of her prenatal care, all of the services that she needs, and she can get, after the baby's born, she can get something called the Family Planning Extension Program to cover her and the baby for the first 2 years.
And that's one of the things, we're going down to the new Affordable Care Act, where they talk about how the and that's a whole other topic. I just want to throw it out there. How they talk about the country is such a deficit, health care rates are so high. It's because, no offense, if you come into the United States, at the end of the day, you are afforded some type of health care, and we always talk about how healthcare is, people sometimes say healthcare is a privilege. No, healthcare is your right. As a human being, everybody gets sick.
Yeah.
You need to get well. So, there needs to be some type of program out there, and I know there's a whole lot of talk in the media and stuff, but, everybody gets sick and everybody needs to get well. And at the end of the day, who should say who should not get service? It's kind of crazy.
Harlem Hospital has been around since 1887. 1887. And we were the people that helped the poor back then.
And made it happen.
There were
limited resources.
There was nothing in place to help the poor who needed health services. And so that shows you the experience that Harlem Hospital has as a municipality to serve the underserved populations.
And then if you think about it, let's say about 5 or 6 years ago, where they had a lot of people who became unemployed, lost their health care. You had people making 6-digit figures, now making it like 30,000, and they're going to public hospitals for services because they know that they won't be turned away.
Yeah, and people forget that the public hospital has the greatest collection of experienced providers that you can have. When those two buildings fell down, the most seriously ill were sent where? They were sent to us.
Yep.
Because we have the experience, the know-how, the dedication, and the wherewithal to take care of the most seriously ill.
Got you. I'm going to keep talking, and we need to go to commercial break, but this topic is getting good. We have a whole lot more information to share with you, but if you have any questions, comments, or concerns, you just want to give us a shout out, please hit us off at 212-650-6903. That's 212-650-6903. So stay at that dial. Do not turn, and we will be right back with some more valuable information.
WHCR 90.3 FM, New York.
It's the 7th annual Harlem celebration of World Tai Chi and Qigong Day, Saturday, April 26th, beginning at 10 a.m. Celebrate with your friends, family, and 70 countries from around the world. At 10 a.m. in each time zone, millions will celebrate world peace and health. World Tai Chi and Qigong Day will feature key energy, acupuncture, Reiki, and energy facilitation sessions with Master Tony Rogers, Reiki Master Glenda Pollard, and more. Also, Qigong, Tai Chi, and natural movement sessions with Grandmaster Roosevelt Gainey, Grandmaster Abdul Musawir, and Dr. Robert Woodbine. There will also be the first annual Standing Still contest with cash prizes and so much more. The 7th annual Harlem celebration of World Tai Chi and Qigong Day will take place in 2 locations in Harlem. At Marcus Garvey Park, located at Madison Avenue and 124th Street, and St. Nicholas Park, located at 135th Street and St. Nicholas Avenue. That's the 7th annual Harlem celebration of World Tai Chi and Qigong Day, Saturday, April 26th at 10 a.m.
Whcr, the Greater Harlem Chamber of Commerce, the New York Academy of Medicine, Emblem Health, Metro Plus, Health First, and City Care invite you and your family to the National Urban Health Conference held April 25th through April 27th. The National Urban Health Conference will feature major presentations on building healthy communities, spiritual health, and an all-day conference on youth health issues. All events of the National Urban Health Conference are free and open to the public, but space is limited. For a full schedule and to register, please call 212-862-7200 or visit www.greaterharlemchamber.com.
WHCR 90.3 FM, New York.
Open up your heart. I know it's struggle to survive. Won't you drop your foolish pride and get your healing? We live together.
Good evening, ladies and gentlemen. This is Sean Shivers, and I am back. Health in Harlem. So our guest tonight, the lovely Vanessa Austin. She is a public health educator at Harlem Hospital Center, and we have Lori Ray. She's a nurse practitioner. And our topic tonight is basically family health, and I'm just going to say keeping you and your family healthy, getting over the stereotypes, or just being scared. We want to get the education out there, and education is power, and the more you know, the more that you will utilize it. So again, welcome, ladies. And Vanessa, because you're ready, because I'm looking at you have everything ready and finished. So you go ahead, take it away. What do you want to talk about next?
Well, I want to just reiterate once again, in case anybody's just joining us, that family planning program at Harlem Hospital Center, it strives to empower the low-income, uninsured, and underinsured women, men, and adolescents to avoid unintended pregnancies and improve birth spacing. I wanted to let you know that we're located in the Ronald H. Brown Pavilion at 46 West 137th Street, New York, on the 2nd floor.
Yep.
So when you come, I'm going to give you the number soon, but when you come to an appointment, try to arrive a little bit early so that you can be ready, because you have to be registered and you have to see a financial counselor if that's your first time. I want to tell people that, be prepared when you come to a clinic appointment. Bring your hospital card if you have one. If you've been to Harlem Hospital ever in your life, bring your card. If not, we'll find your number. But make sure you bring an identification. Identify yourself. Bring proof of your identity, your driver's license, your alien registration, your birth certificate, your passport. If you're a student, if you're an adolescent, bring your school ID. Bring something with you so that we can provide you the services. Bring your insurance card if you have one. If you don't have one, bring some kind of proof of income or any forms that you need completed. Sometimes people need things completed for school or work. Bring it with you. And then also make sure that you have your questions. There are questions that you want to ask your provider. Sometimes people forget. They get in front of the provider and they get scared and they get nervous and they forget. Write it down. Put it on a piece of paper and bring it with you, because the most important member of the medical team is you.
You know what I'm saying? I'm about to say that. So before an individual comes to the clinic, to be on the safe side, they should have some type of form of ID to identify them. They need to have their health insurance or their health card.
Yeah, people don't realize that if you just walk into a clinic and you wanted services and you have no form of ID, legally, we can't see you. We have to make sure that you are who you're supposed to be.
Correct.
So people should make sure that they bring the necessary items they need so that they can come and not have to go home and get anything. if you want to get your services, all you have to do is bring what you need, and we'll take care of you.
And then the last thing you guys said that everybody needs to be their own advocate.
Yes.
You know what I'm saying? If you're sitting, and we say this every single week at Health in Harlem,
Yes.
is that if you're sitting with your physician and you don't understand what they're saying, ask the question, "What are you saying? Can you repeat that?"
Yeah, say it so that I can understand it, because people
correct.
forget the physician's not going to go home with you. You're going to go home with
Right.
you, and you have to understand what he's saying or she's saying, because the physician and the provider is the expert on the medical care, but you're
correct.
the expert on you.
Correct.
And they can't make proper decisions without you, without your involvement, and without your buy-in. I want the provider to talk a little bit about that.
Yes.
Right. So, I mean, without you being forthcoming about what's going on in your own body, it makes it really difficult for us to try to figure out ourselves. This is maybe our first time ever speaking to you. So
Gotcha.
it's the more information about yourself you come in with, the easier it is for us to help you.
So, Lori, tell me this: you have a patient, and let's just say you can tell they're uneasy or they're nervous. What do you say? What do you, as a practitioner, say to them to get them relaxed and to help them open up more and to give you more information?
Well, I mean, first I try to reassure people that it's normal to be nervous, especially when faced with any kind of new experience. And normally we try to start off with questions that are kind of more general or basic to get the information flowing before we go to more sensitive topics like, sexual orientation, sexual history, what you're using for birth control or not using for birth control.
Gotcha.
So I guess starting with more basic things that are easier to answer and then moving forward is how we kind of ease people into the situation.
Got you. Now, Vanessa, at the last segment, you had gave a list, and I just want to announce those again. You had said that as far as services that are offered to the men, you said
Every Monday at 3:00.
Every Monday at 3.
I want to be clear that
Gotcha.
we provide services to men 5 days a week from 9 to 5.
Gotcha.
But we have a special program on Monday.
Just to get more men in.
Men can come any day of the week from 9 to 5. But on Monday, we're there a little later.
Okay.
And we have a special program called the Men's Clinic, Men's Empowerment Network of Services, Men's. And they can get their physical, their HIV and STD testing, their colorectal screening, their laboratory testing, family planning counseling, because as we know, family planning is a man's business too. They can get health education workshops. We can get the family planning benefit is also for men.
Get out of here.
So all of the services that are for women and adolescents are also for men. And we see men, women, and adolescents all week long. It doesn't matter. If you have a man who wants to come on a Tuesday at 3, he can.
Gotcha.
So, but that clinic is specially for men. And I wanted to give anyone who's out there who's listening, they want the number to call for an appointment. It's 212-939-8275.
That's in 212-939-8275.
Or they can also call 212-939-8422.
Got you. So now the next question I'll throw at you is that, men provide of the family. We have a lot of young fathers out there.
Yes.
Do you offer any type of service as far as to show or teach a man how to raise the family properly, how to manage their finances? Are there any type of programs out there because I've heard they have many programs out like that for women. Do they have programs like that for young men or at all?
Well, what we can do at our program is specifically concerning reproductive health and reproductive health issues, but we have a lot of community partners that we can refer them to. We also have social work services that we can refer them to the social worker. So the resources that are in the community, we can avail them to them. We can express what's there and give them the contact information, because like I said, we have many community partners that I do go to and do workshops with. Like I have a program called Arches that I go to their program at Minisync. It's for young men, and I go there and I do a series of workshops.
Got you.
So we will go out into the community to the community partners and provide educational services.
And then the reason I'm throwing that out there like that, because there are a lot of young men out there who are trying to do the right thing.
Yes.
And never had that father figure and just don't know how to, So if you're listening, take advantage of this. go to the clinic. Vanessa did say Monday through Friday, 9 to 5. But, you take down the phone number, and on a Monday, go in confidential. You know what I'm saying? Go in and see what it's all about. You never know, it might benefit you in the long run.
And a lot of people don't know that one of the most beautiful things that a couple can do is to get their preventative health care.
Yes.
Together
at the same time.
A lot of women come in and get their STD testing and their HIV testing on Monday night.
Mm-hmm.
A lot of couples come see me.
Hey.
It's a wonderful thing. It really shows that you care, that you're healthy, and you want your partner to stay healthy, and you're healthy together.
Excellent. So the time right now is 7:26. No, let's keep talking.
We want to talk. We want Lori to tell us about LARC. So I think that's really important that the listeners understand what LARC is.
So we'll do this. Started off, Lori, as far as telling us what LARC is, and then we go to our commercial break. And we go to our commercial break, and then we continue the conversation.
All right. So LARC stands for long-acting reversible contraceptives, and I'm very excited to tell everyone about them because they are the most effective form of birth control that we have available.
Got you. So time right now, 7:27. I noticed that right before we go to break, I always say what the time is. This is Sean Shivers, and you're listening to Health in Harlem, WHCR 90.3 FM New York, and we're going to take a quick break. Again, give us a shout. If you have any questions, comments, or concerns, hit us off 212-650-6903. That's 212-650-6903. We're going to take a quick break, and we will be right back with some more valuable information. Stay tuned.
WHCR 90.3 FM, New York.
If you know the symptoms and get the facts, you'll know the signs of a heart attack. Women, listen to me, and when I'm done, if it sounds familiar, call 911.
Pain in your neck, chest,
arms or jaw,
shortness of breath.
Please tell us more. Cold sweats and nausea, tiredness.
It's time to take it
serious. Back pain, stomach pain, shortness of breath, cold sweats, nausea, dizziness. If you know the symptoms and heed the signs, you'll be around for a long, long time. Women, listen to me, and when I'm done, if any sound familiar, call 911.
Learn a song that can save your life. Get a free download at womenshealth.gov/heartattack.
Women, listen to me, and when I'm done, if any sound familiar, call 911. If any sound familiar, call 911.
A message from the U.S. Department of Health and Human Services.
911.
WHCR, the Greater Harlem Chamber of Commerce, the New York Academy of Medicine, Emblem Health, Metro Plus, Health First, and City Care invite you and your family to the National Urban Health Conference held April 25th through April 27th. The National Urban Health Conference will feature major presentations on building healthy communities, spiritual health, and an all-day conference on youth health issues. All events of the National Urban Health Conference are free and open to the public, but space is limited. For a full schedule and to register, please call 212-862-7200 or visit www.greaterharlemchamber.com.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
I'm tougher than rock. Said I'm black. I'm tougher than rock.
WHCR 90.3 FM, New York.
evening, ladies and gentlemen. This is Sean Shivers, and we're back for our third segment of Health in Harlem, WHCR 90.3 FM New York. And I have two lovely ladies here with me. You got Miss Vanessa Austin. She is the public health educator at Harlem Hospital. And then we have Lori Ray. She is a nurse practitioner also at Harlem Hospital. And we are talking about family health. So, Lori, we're going to continue where we left off last time. So can you continue telling us about this program, the LARC program?
So LARC stands for long-acting reversible contraceptives, which include the implants and the IUDs. So I think a lot of people, when they think of birth control, they just think of birth control pills or maybe the depot shot. But the LARC methods are actually more effective. You're less likely to get pregnant using a LARC than any other kind of birth control. Okay. So the implant is like a small, about the size of a matchstick that goes under the skin in your arm. And the IUDs are little T-shaped devices that go in your uterus. And the good thing about them is that they're highly, highly effective. In a year, if 100 women are using a LARC method to keep from getting pregnant, less than one of them, like essentially no one, is going to get pregnant. Gotcha. And they're good for everybody.
So a LARC is like a patch somewhat? Can you say you stick it under your skin or?
So the LARC methods are put in at our clinic. Okay. So they're inserted by a trained provider. Got you. And that's one of the reasons that they're so effective is that you can't forget to use them. They're there. Okay. They stay there for several years, and when you decide you want to get pregnant, you can remove them early, or if you don't want to have children, you leave them in for the entire length that they're good for. But adolescents can get them. It doesn't matter if you've never had children, high blood pressure, HIV, it doesn't matter. They're really effective, good methods for almost everybody.
And we have them. It's not like you get a prescription and then you come back. We have them on hand. That is the difference between other clinics and the family planning program at Harlem Hospital. We have the LARC methods on hand, and we can provide the service right there. If a patient comes in for a pregnancy test, we have walk-in pregnancy tests. Gotcha. And if a patient decides, okay, I had my pregnancy test, I'm not pregnant, I don't ever want to have the chance to be pregnant because I forgot my pill again. We can give them same day access. They can register to see the provider, and the provider can provide them with the IUD or the implant right there on the spot. So
the way young women find out about these different products, this is just having a normal conversation with the gynecologist, whatever. For the most part, is this how they find out about these new?
Yeah, I mean, I wish it was more well known in the community, but a lot of times they're hearing about it for the first time when they come see me.
And also when we were in the community at health fairs or workshops or trainings, we go all over the community and we provide this information to groups or one at a time. So
I'm going to throw this out there. I don't know if you have the answer because my mind is churning. You have all these programs for young women. What about now? Let's go back again to the young men. We do have the men's health clinic, but what type of programs do we really have out there for young men? And I'm thinking about now myself growing up. I know times are changing, but. Yeah, you have all these young men, what type of services or how do they learn about some of these services?
Young people have the greatest invention known to man. They have iPhones. Yeah. And they have computers.
I wish I had that when I was growing up.
There are so many wonderful programs in the Harlem community for young men. If they would just avail themselves the same energy they have to Google what Kanye West is doing. If they would Google what services they're looking for, they would find it. And also when you come to Harlem Hospital and you speak to a public health educator like myself and my coworkers, we can also help you find resources that you're looking for. When I'm doing an HIV test, the test takes 20 minutes, and the person, sometimes they're asking me, I want to go and get my GED. So we'll sit and we'll Google the programs that are in their area. So part of treatment at Harlem Hospital is not just medical treatment, but it's a holistic approach, finding the patient exactly what information they need, and if we can't help them, we'll refer them to the social worker who can get more in depth.
And then that goes back to our show from last week, Health Leads, and the program was about how physicians write prescriptions for medication, but you also have physicians who write prescriptions for items that a patient may need in order to get healthy, whether it's food, shelter, etc. So are you affiliated with that program at all?
Yeah, the Health Leads people sit right outside our clinic. There's a table right outside the family planning program that they can be referred to find out resources in the community. So we have the social worker and the social service program and Health Leads right there. There's more than enough information. We have the providers for the health services like Metro Plus. They're right there on the floor with us.
Excellent.
Yeah, every patient we see is screened for their needs. So if they have housing needs, educational needs,
insurance,
child care, food, utility, whatever, they get sent to the Health Leads table to connect them with services.
You know, do all public hospitals offer services like this? Because I have so many different guests that come onto the show, so many different programs. It's always another program. I was like, seriously, that happens at Harlem Hospital? I mean, I'm going to assume that it happens throughout HC, but I don't know. I've worked among some of the stuff that somebody puts together and creates a program, and I was like, I would never thought of that. I mean, I'm just babbling right now, but it's just how many programs are out there, and I guess my only thing is that making sure that the community knows about it, because a lot of people don't.
Right. Yeah. I'm going to leave you with a commercial about the men's clinic and the family planning program, because it is so vitally important that the community members avail themselves to the services that we have for them. People think that because they're illegal alien, they can't come to the hospital and get services. They feel they'll get deported or somebody will report them. You said the magic word, confidential. They are confidential services that are provided for everyone, regardless of your ability to pay. Come, let us empower you, regardless of your ability to pay or your health insurance status. We need for everyone to know that we're here for you. We are a pillar of the community that's been here since 1887. We understand the needs of our community. We understand the changing face of our community, and we want to be there for you.
I love the passion. You know what I'm saying? I love working at Harlem Hospital so much, and every single person that comes onto the show, they just have that passion, and I love when that passion is passed on to the patient.
Yes, I love Harlem Hospital. I was working in another department in Harlem Hospital, and I decided to change jobs. I changed job in Harlem Hospital. So it's a wonderful place to work, and the community is so multicultural and diverse, and the staff is culturally competent and has the ability to work with the community, because the hospital staff is as multicultural and competent as the community.
You're right. So Vanessa, are there any other programs that you have not mentioned that you are a part of, that you are affiliated with, that you just want to bring to the attention of the community or any other programs?
Well, like I said, Harlem Hospital has very many programs. You can just Google whatever illness or ailment that you have. You'll find it at Harlem Hospital. When I read you, if I read you the list of all the services, all the comprehensive services you find at Harlem Hospital, you would be bored, because it would take me so long. Because we're a level 1 trauma center. We have the state-of-the-art birthing. We have the state-of-the-art bariatric. We have the state-of-the-art everything. We are a center of excellence for so many things.
Got you. So let's just say that I'm hearing the show. I like what I hear. I make the phone call. I come into the clinic. What would be the experience if someone's walking in the door for the first time?
Well, I want people to understand that if you do your homework and you're prepared and you know what you're there for, you will get the services that you need. You have to remember to bring your identification, bring your clinic card or whatever it is that you have. If you don't have insurance, bring your proof of income, so that even if you are an illegal alien and you don't have residency, or if you don't have a social security number, bring the items that you need so that we can service you. It doesn't matter. We will still provide you the services. If you have a little job and you don't make a lot of money, the fee is going to be based on your income.
Correct. Based on your income.
So I don't want anybody to feel that they can't get services because they don't have a lot of income or they don't have insurance.
Got you.
And once you register, you have to register, and you come up to the clinic, you bring your paperwork, and then you will be seen by a PA who's going to take your blood pressure, your vital signs, and that kind of thing. And then you're going to wait and see the provider, and we have the most excellent provider you could ever imagine.
So what services utilize the most in your area? I mean, you have people coming in utilizing the service. Well, what service would you say is utilized the most?
Well, I'm going to let the provider tell you what's the most, because she's in the trenches.
Got you.
You mean in terms of what people come in looking for?
Like for the most, in this community.
So mostly what we're dealing with is contraception. So people keep getting refills on their birth control, or just keeping up with it, or starting a new birth control.
Gotcha.
And then we also do annual exams for men and women.
Gotcha.
So sometimes people might even need like a work form filled out that we're able to help them with. We also do postpartum visits for women who have recently given birth.
Gotcha.
And
infertility. Yes. There are women who want to have children and they're having a problem having children. We have an infertility provider there who can help them with that. And, people have to understand that it's very important to come to see the provider for whatever issue that you have. And reproductive health is very important.
Of course.
Even if you don't think you have a problem, just to come in for preventative care is really important, because we do screenings, and, we might find out that you do have high blood pressure or diabetes or something that you had no idea, and at least we're able to catch it early when it's easier to treat.
Correct.
Speaking of preventative, the most recent national estimates is that approximately 19 million cases of STDs each year, and half of them are among people 15 to 24 years old, and 65 million Americans have had at least one STI. So preventative care is key.
You're right.
People can come in and walk in and have a walk-in pregnancy test, and at the same time they get an HIV test, because if you might have gotten pregnant, that means you had unprotected sex.
Right.
You might have gotten an STI, or you might have gotten something. So we give you comprehensive care. We give you the pregnancy test, we give you the HIV test, we can do STI testing. You want to make sure that you're healthy in all ways.
So how often do you have like a 13, 14, or 15-year-old male or female walking up into the clinic without their parents, looking for assistance? How often does that happen?
So as of right now, we don't have a huge population, but it's picking up. Also, at Harlem Hospital, there's an adolescent clinic, so a lot of the adolescents are seen there.
Okay.
But more and more, we are seeing them in family planning clinic as well.
Interesting. Time right now is 7:44. You're listening to Health in Harlem, WACR 90.3 FM, New York. This is Sean Shivers, and we're about to take a break. So if you have any questions, comments, or concerns, hit us off at 212-650-6903. That's 212-650-6903. We're going to take our last and final break, and we're going to give you about 15 more minutes of valuable information, so please stay tuned.
WHCR 90.3 FM, New York.
It's the 7th annual Harlem celebration of World Tai Chi and Qigong Day, Saturday, April 26, beginning at 10 a.m. Celebrate with your friends, family, and 70 countries from around the world. At 10 a.m. in each time zone, millions will celebrate world peace and health. World Tai Chi and Qigong Day will feature key energy, acupuncture, Reiki, and energy facilitation sessions with Master Tony Rogers, Reiki Master Glenda Pollard, and more. Also, Qigong, Tai Chi, and natural movement sessions with Grandmaster Roosevelt Gainey, Grandmaster Abdul Musawir, and Dr. Robert Woodbine. There will also be the first annual Standing Still contest with cash prizes and so much more. The 7th annual Harlem celebration of World Tai Chi and Qigong Day will take place in 2 locations in Harlem. At Marcus Garvey Park, located at Madison Avenue and 124th Street, and St. Nicholas Park, located at 135th Street and St. Nicholas Avenue. That's the 7th annual Harlem celebration of World Tai Chi and Qigong Day, Saturday, April 26th at 10 a.m.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 to 12 midnight on Whcr 90.3 FM. Peace.
I'm tougher than rock. Said I'm black. I'm tougher than rock.
WHCR 90.3 FM, New York.
Make each other try to understand that we have got to love. Oh yeah, to live together, all as brothers and sisters. Oh, we will surely perish.
Good evening, ladies and gentlemen. This is Sean Shivers, and I'm back for our last and final segment of Health in Harlem. And our guest tonight is Miss Vanessa Austin. She is a public health educator at Harlem Hospital, and we got Lori Ray. She's a nurse practitioner, and our topic tonight is keeping you and your family healthy. We threw down a lot of valuable information to you, and I hope it was helpful, and I hope you utilize it. And as we always say on Health in Harlem, don't be stingy. Make sure you share that information with everyone around you. So tomorrow when you're at the gym, say, hey, guess what I learned on Health in Harlem? When you on the train, say, hey, guess what I learned at Health in Harlem? You know what I'm saying? So just make sure you just share that information. So Vanessa, you said there's a couple of things that you just wanted to throw at the community. Let us know what that is, and then we're going to wrap up with the brief summary of tonight's show.
Okay, I just wanted everyone to know that, unfortunately, in the Harlem community,